Kidney stones. Patient will present with classic cloaky flank pain radiating to groin, can be associated with hematuria, nausea, vomiting. There will be gastrovertebral tenderness on physical exam. Kidney stones can cause hydronephrosis and post-renal azotemia. There are 5 common types of kidney stones. Let us discuss each one by one. Read this clinical scenario. 45-year-old man presents in emergency department with symptoms of severe left-sided flank pain radiating to his groin. Pain began 3 hours ago. Patient has nausea but no fever or chills. There is gastrovertebral angle tenderness on left side. What is the most likely diagnosis? This is classic presentation of ureteric stone, left-sided flank pain radiating to groin with gastrovertebral angle tenderness. In case of epididymitis, there will be localized scrotal swelling with tender epididymis with no flank pain. In case of testicular torsion, there will be sudden severe scrotal pain, high riding testicle with absent cremasteric reflex. In case of uric acid kidney stone, patient will present with severe flank pain radiating to groin with history of gout, tumor lysis syndrome, or myeloproliferative disorder. These are radiolucent stones on X-ray, rhomboid or diamond shaped in acidic urine pH and dehydration promotes uric acid kidney stones. Treatment involves alkalinization of urine and allopurinol for gout. 45-year-old man with sudden right-sided flank pain radiating to groin. History of obesity, started a high protein, low carbohydrate diet. Urine analysis shows low pH and no crystals seen on light microscopy. Non-contrast CT scan shows radiolucent stones, that is classic for uric acid stones. As we all know, protein metabolism yields uric acid. High protein diet means increased excretion of uric acid in urine, leading to increased risk of uric acid stones. Read this question stem. Acute right flank pain, history of gout, CT shows 6 mm stone, plain radiograph shows no visible calcification, radiolucent, that's uric acid stone. In gout, increased uric acid is excreted in urine. It precipitates in acidic condition, leading to uric acid stones in gout patient. Read this question stem. For 55-year-old man, acute right flank pain, history of gout, images shows radiolucent stone, urine analysis reveals acidic pH and rhomboid crystal, that is uric acid stones. Hyperuricemia leading to precipitation of uric acid crystals in acidic pH. Treatment of uric acid kidney stones involve alkalinization of urine and allopurinol for gout. If you see a patient with flank pain radiating to groin with recurrent UTI by urease positive organism, you should suspect Struvite type kidney stones. Urease positive organism convert urea into ammonia, which increases the pH of urine. Alkaline urine favors the formation of magnesium ammonium phosphate stones, also known as Struvite kidney stones. They form Staghorn calculi. Treatment involves acidification of urine with ammonium chloride, surgical removal if there is a large stone. Read this question. 28-year-old woman, recurrent UTI, CT shows Staghorn calculi, urine pH is 8, most reasonable organism for stone formation. As we all know, patient with flank pain, recurrent UTI, you should suspect Struvite type kidney stones which are caused by urease positive organism. They convert urea into ammonia, increasing the pH of urine. Alkaline urine favors the magnesium ammonium phosphate type kidney stones. Treatment involves acidification of urine with ammonium chloride. Read this question stem. 32-year-old woman, recurrent UTI, urine analysis shows alkaline pH, coffin lid crystals on microscopy. CT confirms the stones reasonable organism for stone formation. Proteus is only option which is urease positive, converting urea into ammonia, raising the pH of urine. Alkaline pH favors the struvate kidney stone formation. If you see a patient with flank pain radiating to groin with history of hyperparathyroidism, ethylene glycol ingestion, vitamin C overuse, or Crohn's disease, you should suspect calcium oxalate phosphate stones. They are enveloped or dumbbell-shaped. Treatment involves thiazide diuretics, which increases the reabsorption of calcium in distal tubules, thus decreasing the risk of calcium stones. If you see a patient with flank pain radiating to groin with history of Crohn's disease, you should suspect calcium oxalate stones. Read this question stem. 45-year-old man, severe left flank pain radiating to groin, history of Crohn's disease. CT shows 4 mm stone in left ureter composition. It is calcium oxalate type kidney stone. Fat malabsorption in Crohn's disease. Calcium binds dietary phyte in gut. Less calcium available to bind oxalate. Increased oxalate absorption in GIT causes increased level of oxalates in blood, thus increasing the risk of increased oxalate excretion in urine, therefore increasing the risk of calcium oxalate stones in Crohn's disease. Read this question stem. 22-year-old man, family history of recurrent calcium oxalate stones. 24 hour urine collection shows elevated oxalate excretion with normal calcium level. This is Crohn's disease involvement leading to calcium oxalate type stones. Read this question stem. 60-year-old woman with primary hyperparathyroidism presents with flank pain. Lab shows hypercalcemia, hypercalciuria. What is the mechanism behind calcium oxalate stone formation in primary hyperthyroidism? As we all know, PTH has 3 main functions. It acts on PTH stimulates bone resorption, calcium released from bone, increasing serum calcium level. PTH also activates vitamin D, causing increased absorption of calcium from intestine. It also increases the absorption of calcium from renal tubules. Excess calcium spills into urine, causing hypercalciuria, increasing the risk of calcium stone formation. Calcium stones are most common type of kidney stones. Hypercalciuria is major risk factor for it. Read this question stem. A patient with ethylene glycol ingestion develops AKI and flank pain. Urine analysis shows calcium oxalate crystals. What is the mechanism behind it? Metabolism of ethylene glycol yields oxalic acid, leading to increased level of oxalates in blood and urine, thus increasing the risk of calcium oxalate stones in patient who has ingested ethylene glycol. Read this question stem. Man with calcium oxalate stone What should be given to reduce the urinary calcium excretion to prevent reoccurrence? Thiazide diuretics are given because they act at distal tubules to increase the calcium reabsorption, thus decreasing the level of calcium in urine, thus decreasing the risk of calcium stones. Read this question stem. 28-year-old man, flank pain radiating to groin and macroscopic hematuria. CT shows stone. Analysis reveals calcium oxalate. He has history of vitamin C intake. Mechanism of stone formation. As we all know, metabolism of vitamin C yields oxalate. Increased level of oxalates in urine increases the risk of calcium oxalate stone in patients who are using vitamin C supplements. Read this question stem. 34-year-old man, left-sided flank pain radiating to groin, associated with nausea and hematuria. CT shows stone in left ureter. Urine analysis revealed dumbbell-shaped, enveloped or dumbbell-shaped crystals, which are classic for calcium oxalate stones. Read this question stem. 31-year-old woman, vitamin C supplementation develops left-sided renal colic. Urine analysis shows hematuria and envelope-shaped crystal. What is the mechanism behind it? Vitamin C metabolism yields oxalate, which increases the risk of calcium oxalate stones in patients who are using vitamin C supplements. Read this question stem. 55-year-old man passes a 7 mm ureteric stone. Long-term preventive measure. If stone analysis shows pure calcium oxalate and has idiopathic hypercalciuria. As we all know, thiazide diuretics act at distal tubules to increase the calcium reabsorption, thus decreasing the risk of calcium stones. Patient with kidney stones should have high fluid intake, low sodium diet, low animal protein diet, and citrate supplementation to decrease the risk of stone development. If a patient presents to you with flank pain radiating to groin, hexagonal crystals, and positive cyanide nitroproside test, you should suspect cystine type kidney stones. Cystinuria is autosomal recessive disorder characterized by defect in renal tubular reabsorption of cysteine, ornithine, lysine, arginine, leading to increased risk of cystine stones. Treatment involves urine alkalinization or penicillamine. Read this question stem. 25-year-old man with recurrent kidney stones, cyanide nitroperoxide test is positive. Hexagonal crystals on macroscopy, stone composition, cystine. Read this question stem. A patient with severe colicky flank pain radiating to groin, history of kidney stones since childhood, acidic pH, hexagonal crystals, that is impaired renal tubular reabsorption of cysteine, ornithine, lysine, arginine.